Hello, everyone. This is Stephanie Anderson of the Hair Loss Professionals Group, and welcome to today's educational webinar entitled Women's Hair Loss and the ReTress product line. I want to thank everyone for taking time out of your busy schedules to be in attendance today. Now, in the interest of saving time, we're going to start the webinar, so as always, please mute your phones. Now, I am so pleased to introduce our special guest presenter, Dr. Candace Spann, co-owner of Couture Dermatology and Plastic Surgery in Las Vegas, Nevada. Now, Dr. Spann is a board-certified dermatologist. Her areas of expertise include women's hair loss, the prevention and treatment of various skin cancers, as well as the treatment of numerous skin disorders. Having completed her Bachelor of Science degree in 1995 from UCLA, Dr. Spann then went on to graduate from Meharry Medical College in Nashville, Tennessee in 2000. After graduating from medical school, she completed her internship and residency at St. Luke's Roosevelt Hospital Center in New York City, a Columbia University Hospital program. After completing her residency, she spent 2 years in private practice in New York City, then 2 years in Salt Lake City. She has now been in her hometown of Las Vegas since 2009. She and her husband, board-certified plastic surgeon Dr. Marvin Spann, opened Couture Dermatology and Plastic Surgery in 2012. Dr. Spann is a fellow of the American Academy of Dermatology and a diplomat of the American Board of Dermatology. She has been recognized numerous times for her dedication to patient care and has been featured as a top dermatologist in Nevada by several organizations and recognized as a Castle Connolly top doc, and has received the highest patient satisfaction rating from the Intermountain Medical Group. Now, Dr. Spann has also developed and launched the ReTress product line for women with thinning hair. So, as you can see, we are in for a treat. Now, remember, these educational webinars are interactive, and you are invited to ask questions. But because your phones are muted, we request that you ask any questions you have by using your computer or laptop and posting them in the chat box, and we will open the phone lines during the designated question and answer segment of today's webinar. Remember, call-ins or post-webinar viewers can email questions to me at customercare, that's customercare, at trinitylacewigs.com. And those will be posted and answered for everyone in the Hair Loss Professionals group to see. Now, what Dr. Spann has to say today is really valuable information. It's life-changing information, so I recommend that you just don't listen to what she has to say. I invite you to get a pen, a notepad, a piece of paper, and take notes. It really will be worth it. So after this brief video clip, please help me to welcome Dr. Candace Spann.
1 out of 2 women will experience hair loss within her lifetime.
I'm self-conscious about it.
The front of my hair especially. I feel like my part is just parting.
Something I do think about it a lot. I think about it all day long, and I look at every other woman I see. Nothing has helped. So I'm figuring I'll probably need a wig someday.
I used to feel exactly like those women. At age 25, I was losing my hair. I was losing my identity. I was losing my hope. Hair loss had affected every woman in my family. My grandmother died with only 10% of her hair remaining. I tried everything. Nothing worked. Some made it worse. Desperate, I started my own hair loss research. Hello, I'm Dr. Candace Spann. I'm a board-certified dermatologist, a hair loss specialist, and the creator of ReTress. ReTress is a product line exclusively for women with thinning hair. Female hair loss is a hidden epidemic because female hair loss is often diffuse throughout the entire scalp versus concentrated like male baldness. It can be less obvious in the beginning. To make matters worse, the media treats hair loss as if it's strictly a male problem. Consequently, society is more aware and more accepting of male baldness. However, according to the American Hair Loss Association, fully 40% of hair loss sufferers are female. In fact, 1 out of 2 women will suffer from noticeably thinning hair by the age of 50. Losing their hair is emotionally devastating for women. When it was my hair that was filling up the brush, shower, bathroom floor, I did what all of my patients do. I tried everything. I was growing desperate. None of the products available to me were working because they were all treating the wrong problem. My patients with hair loss were all suffering from the same frustration, so I set out to find a solution for all of us. In my own research, I discovered 2 important things. First, women's hair loss is not the same as men's, and the products on the market had all been developed for men, and women were told they can use them too. The fact is, it's easier to treat men's hair loss. In men, a primary cause is that DHT, a byproduct of testosterone, attacks and kills the hair follicles. In women, there are many causes of hair loss. Inflammation in the scalp, vitamin deficiency, styling practices, normal aging, and underlying medical problems are all potential causes of women's hair loss. Second, I discovered there is no one magic ingredient that can solve visibly thinning hair in women. A complex of unique ingredients is needed to target many different factors. After years of work, I found the proprietary combination that we now call ReTress. I tested the products first on myself, then on my patients, and eventually in clinical studies. In the clinical study, 95% of women reported thicker, fuller hair with the use of ReTress. After reaching the 16-week mark in the clinical study, we sat down with some of the 50 women participants to see how ReTress lived up to their expectations.
My husband was the first person who noticed, and he notices nothing. And he said, boy, your hair's looking really thick. You don't look like you're bald anymore.
I can literally use the word dramatic difference.
It seemed like it didn't take that long. It's thicker and things have grown in where, the hair's grown in more.
It's just amazing. It's fabulous.
It's fabulous.
It works.
Today, I am proud to introduce ReTress. ReTress is a 4-product system: a shampoo, conditioner, serum, and vitamin supplement that uses natural active ingredients to specifically address many of the factors leading to women's thinning hair. At its core, ReTress has a patented tripeptide complex designed to support natural blood flow to the scalp and anchoring the hair to the follicle. Providing the hair follicle hasn't been dormant for too long or completely scarred over, patients, testers, and I personally have noticed that hair is visibly fuller looking. Better yet, ReTress can be used as a preventative to keep the scalp healthy before trouble starts. ReTress is an easy-to-use 4-step system. Step 1, our ultra-moisturizing shampoo is specifically designed to calm irritation on the scalp using a blend of essential oils. It contains a patented and proprietary ingredient complex to support natural blood flow to the scalp and support the normal anchoring of existing hair. The blend of peppermint and spearmint oils leaves the scalp feeling cool and refreshed. It contains no sulfates, so it may not last. Soft and more manageable. It's also safe for permed and color-treated hair. Use ReTress shampoo as you would any shampoo, following your normal schedule. Step 2, our conditioner is for restoring dry, brittle, and tangled hair to further reduce breakage. It helps to improve manageability and adds volume to tired, limp hair. Like the shampoo, it also contains the patented and proprietary active ingredient complex, as well as a blend of essential oils to strengthen and rejuvenate the hair. Use ReTress conditioner as you would any conditioner following your normal schedule. Step 3. Our serum provides a concentrated delivery of the ReTress active ingredient. The serum contains the patented biotin tripeptide complex that helps the follicle and supports natural anchoring of the hair. It also contains herbal soothers to calm an itchy or inflamed scalp. It does not contain minoxidil, the ingredient in most men's hair loss remedies, and ReTress testers reported a 95% success rate. Apply the serum by putting 1 to 2 full pumps on your fingertips and massage directly into the affected areas of the scalp. The serum should be applied once every day and should be left in and not rinsed out. Overuse of the serum can cause flaking, so it's important to use only the correct amount. Step 4. Our supplements contain high-dose biotin, vitamin A, and zinc. Each of these vitamins plays a key role in supporting healthy hair and hair growth. Deficiency in these vitamins has been shown to be a factor in hair loss. Use as directed. Take 1 tablet daily. At week 1, hair becomes much more manageable. At 4 weeks, shedding is dramatically reduced. At 8 weeks, rejuvenation begins. At 12 weeks, visual improvement in hair density. At 16 weeks, friends and family will often note thicker, fuller hair.
Whatever the system was, I followed it religiously, did what I was supposed to do. I saw results. It works. Ladies, it works.
My glory days are coming back.
This product is worth every penny that you would spend on it.
Oh, it feels great to have found a solution. I'll use this for the rest of my life. I thank Dr. Spann so much. It makes me feel like a new human being.
Awesome presentation. What we're going to do is give you complete control. We're going to do that now.
Thank you so much, Stephanie. I am downloading the control right now. And thank you for that wonderful introduction and for sharing the video. As I am downloading, I can tell you that I am Dr. Candace Spann. I'm the board-certified dermatologist, as you now know, and the founder and the creator of ReTress. Okay, let's see, start sharing. There we are. Are you seeing my screen?
I do.
Okay, perfect. Founder and creator of ReTress. As you saw in the video, my experience and my story, unfortunately, is what has led me to this point of understanding women's hair loss a little bit more than we previously did. Our mission at ReTress is to create products that are exclusively for women suffering from thinning hair and to kind of ease the emotional pain and embarrassment. We're focusing specifically on women's issues, just kind of dividing hair loss into men's and women's hair loss, focusing more on women's issues because it is something that is so important. So we know that 50% of women will experience noticeable hair loss by the age of 50. We know 100% of those women are emotionally devastated when hair loss occurs. In fact, in 2012, in the Journal of the American Academy of Dermatology, there was an article about quality of life of women related to hair loss. And what they found was that women were affected sometimes out of proportion to their hair loss. In other words, the degree of hair loss did not dictate the amount of emotional devastation from it. So it's important that
I don't mean to interrupt, but are you on the presentation itself, or because we're seeing a picture of your screensaver?
Oh, I'm going through the presentation itself, yes.
Okay.
Okay, why is that happening? Let's see. Let me escape out of the presentation.
Sure.
And go back to, okay, the installer is open and it says that Your meeting is now running. The download present application, it says.
Okay.
Let me put it back up and see if I start over. Are you seeing it now?
No, I'm not, but no worries. I do have the presentation here, and if you would like, we could switch it back to where it won't be the flow that you probably, but I don't mind if you just tell me when to advance.
Okay. Let's do that.
Just go ahead and switch back to me.
How do I do that?
To your left, it'll say switch presenter. Let me see if I can ask it back. Okay, so there we go. It's not a problem. That's what happens sometime in live presentations.
I don't know why here we are. Okay.
Yeah, so hold on just a second. Let me fire it up. And just tell me where to advance to. And I apologize for the interruption, but I know
that's okay. Should we just start over from
sure.
after the video? Okay. Let's take it from there, okay?
Great.
Okay. So I am Dr. Candace Spann, board-certified dermatologist, as you saw in the video. Thank you so much for your attention. And my story has been driven by my own personal experience, as you saw. In fact, as I was going through this problem, when I was a dermatology resident, I started to see lots of women with the same problem, and it occurred to me that men's hair loss and women's hair loss really needed to be treated as two separate conditions. So our mission here at ReTress is to create solutions exclusively for women and to help to just address the emotional pain and embarrassment that's caused by hair loss. Next slide, please.
Sure.
So why have we focused so much? Well, we know that 50% of women will experience noticeable hair loss by the age of 50, and we know that 100% of those women are emotionally devastated when it occurs. In fact, in 2012, in the Journal of the American Academy of Dermatology, an article was published that showed that the degree of embarrassment or emotional humiliation that is suffered by women is not dictated by the amount of hair loss that they have. In other words, the degree of hair loss does not correlate to the emotional stress that it's caused. And not everybody knows the Journal of the American Academy of Dermatology, but everybody knows Oprah. And a few years ago, in Oprah's magazine, in the editorials, they mentioned that while they get thousands upon thousands of emails every month, nothing is as emotionally charged as the letters that come from women dealing with hair loss. So this is really a problem, and the emotional devastation is definitely real. Next slide, please. So knowing that 40% of the total hair loss market is female, that means that of the $3.5 billion per year that's spent on hair loss, $2 billion spent by men, $1.5 billion that is spent by women. And when we look at the breakdown of what's available to women, we have minoxidil, of course, and minoxidil is now available in 2% or 5% formulations. It was recently FDA approved as a stronger strength for women, but it does have some side effects that can be unwanted. You can have unwanted hair growth on the face or on the body. Side effects can include palpitations and swelling or edema. And so it's not an ideal situation, and also it does have a very real side effect of scalp inflammation. And as we'll talk about, inflammation in the scalp is one of the issues that affects women with hair loss. We have prescription medications that we use for men. Everybody's probably heard of Propecia. The generic name is finasteride. And these medications cause such severe birth defects that women of childbearing age should not even touch the tablets. So obviously that's not an option for a lot of women. There are lots of non-specific compounds that are available that aren't specifically for women. There are laser treatments now, the low-level light therapy treatments, which are FDA approved, and we will talk about those some. And then there are surgical procedures, but really only 20% of women are really good candidates for hair transplant. Next slide, please. So when we started to think about why a lot of the things on the market weren't working, we realized, well, that's because hair loss in men is different from hair loss in women, and everything on the market was developed for men. So what's happening in men? In men, we know DHT, which is a byproduct of testosterone, attacks and kills the follicles. We know that for men. In women, there are so many reasons. In my case, it was genetic. I have several women in my office where it's related to their thyroid. I have numerous patients where it's styling practices, autoimmune disease, vitamin deficiency, crash dieting, just normal aging, just around menopause, stress, childbirth, and the list goes on and on. So because the causes are so manifold for women with hair loss, we know that just using a product that blocks DHT will not be successful. Next slide, please. So it became clear at some point that I had to stop thinking about the cause of women's hair loss because that's a Pandora's box. But there were some things that we all had in common regardless of the cause. So regardless of the cause, all women need to nourish their follicles, maybe improve blood flow as much as possible. All women need to calm irritation in the scalp. It makes sense that an inflamed scalp will lose its hair. We all need to improve anchoring of the hair to the follicle, or in other words, to keep the hair that we have because the shedding is so devastating. And we also all need vitamin sustenance. As women, we're all constantly trying to lose a few pounds, or we're busy feeding everybody and taking care of everything, and we tend to put ourselves last. And between having a menstrual cycle every month and then putting ourselves last, we all end up a little depleted of vitamins. So vitamin sustenance is really key with hair growth. Next slide, please. So the solution that I came up with is ReTrust, the Retrust System. As you heard in the video, ReTrust is a 4-part system, shampoo, conditioner, serum, and vitamin supplement that addresses all of the issues that I just outlined. And as such, we are seeing thicker, fuller hair regardless of the cause of the thinning. Next slide, please. So ReTress is an all-natural system. It is free of parabens, sulfates, phthalates, minoxidil, and it's even free of fragrance. We know that fragrance is the #1 irritant worldwide to the scalp. So what we are doing is we're using a blend of essential oils so that ReTress has a wonderful experience with it, and it actually smells great, but it is completely fragrance-free. And we know that it's safe for color-treated hair. We know it's safe for processed hair. We know that it's safe for sensitive skin. And because it's all natural, we've even been using it very successfully in women who are postpartum or who have just given birth, and also in women who have recently completed chemotherapy. Next slide, please. So we did conduct a clinical trial. 47 women completed the clinical trial, which was 16 weeks long. And we were sure when we conducted the clinical trial to include women of all different walks of life, different ages, races, ethnicities, hair types, and we wanted to be certain that we even represented lots of different hair problems. So we didn't just focus on women that we knew would be home runs. We included all different causes for hair loss. And in our clinical trial, we had 95% of women see significant or moderate improvement. You can see that breakdown is 75.61% of women had significant improvement, 19.51% had moderate improvement. The one woman in the study who had slight improvement had untreated polycystic ovarian syndrome because she was a breast cancer survivor, so she couldn't be exposed to the hormones. So we were definitely fighting an uphill battle with her, but even she did see some slight improvement. Next slide, please. I'm about to show you some photographs from our clinical trial, and the photographs have not been retouched. We did have a photo studio that you can see here in the picture where every angle of the light was measured, every light was calibrated, the distance from the camera to the scalp was measured, as you can see here. And we did this to make sure that nothing that you're seeing is trick photography. Everything was medically controlled so that we did have exact conditions in the before and afters. Next slide, please. So here's a 58-year-old Caucasian female with female pattern hair loss. You can see that before and after at 16 weeks, she did have some nice filling in of her part. Next slide, please. The second patient is a 65-year-old Hispanic patient, again before and after at 16 weeks, and she has early female pattern hair loss. You can see that her hair is not only looking much thicker and fuller, much healthier, it's filling in quite nicely there. And by the way, we did ask the patients to please keep their color and their styles exactly the same throughout the trial. The third picture shows a 33-year-old Caucasian woman with early female pattern hair loss. She was the woman in the video who said she felt like her part was just parting. And this is an important point for all of us because when I initially looked at her, I couldn't really see that there was a problem. And it wasn't until I looked at her after pictures at the 16-week point that I realized she was absolutely right. Her hair was thinning. This is important because until a woman has lost 50% of her hair, it will not be noticeable to the clinician or to the stylist or to her friends and family. So it's important that we don't invalidate what she is telling us by saying, I don't know, you look fine to me. If we're waiting for a woman to lose 50% of her hair before we start treating her, we are missing an important window in order to be most effective. Next slide, please. Here's a 65-year-old Caucasian woman. She's the woman who said that her husband was the first one to notice and he notices nothing in the video. And you can see that she did have just a beautiful filling in of her hair before, and the after here is only at 12 weeks. She just really did beautifully through the study. Next, please. Here's a 74-year-old African-American woman. Now, this woman had been suffering with thinning for 30 years. So I legitimately didn't expect to get much. You can imagine she and I were both thrilled with the result that she saw here. And of course, some of the follicles are permanently scarred at 30 years later, but you'll see here that it was worth treating her because quite a few of her follicles were present, they were just dormant. Now this next patient is a 65-year-old Caucasian woman, and this one's particularly fascinating. She is vegan. She has severe dietary restrictions, and as such, she was suffering from protein deficiency and a severe burning in her scalp. The burning in her scalp was so severe that it would actually wake her up at night. And as her physician, I tried everything first, including steroids and some really heavy hitter medicines like cyclosporin, just trying to get this inflammation in her scalp under control. And I was largely unsuccessful with all of the conventional treatments. So I kind of threw my hands up and said, well, let's put you in the ReTrust clinical trial and see what happens. I'm happy to report to you that at 16 weeks, the burning in her scalp had completely stopped. And you can see here in her after that she had quite nice filling in, getting started of her part. Next slide, please. This is a 55-year-old woman who has autoimmune disease. Unrelated to ReTrust, she was in fact hospitalized during the clinical trial. And you can see that she did have such a nice filling in of her frontal part before and after here at 16 weeks that she exemplifies the emotional commitment that people will have when you get them on a regimen that really works. In fact, even though she was hospitalized during the clinical trial, she never missed a single dose or a single application of her ReTrust serum. She was there in her hospital bed applying ReTrust to her scalp every day, and you can see the nice result that she had with the filling in of her frontal part. Next slide, please. There's a 59-year-old African-American woman with a styling-induced type of hair loss. In dermatology, we call this CCCA, or central centrifugal cicatricial alopecia. This is an extraordinarily difficult type of hair loss to treat in that it is scarring and progressive. She thankfully was early in her CCCA, but I wasn't sure that we would get any kind of a result. So you can imagine that both she and I were thrilled at 16 weeks to see this type of filling in. And I did, in fact, just see her just over a week ago, and she has continued to improve from here. Next slide, please. Here's a 64-year-old woman. Again, before and after at 16 weeks, you can just see a very nice filling in and improved density of her scalp with her female pattern hair loss. Next slide, please. And this woman's particularly interesting. She's a 57-year-old woman who has Hashimoto's thyroiditis that actually I diagnosed. When she came to my office, her hair was literally coming out just by the handful. And it was wiry and it was unmanageable, and it didn't have just that soft feeling that hair should have. You can see here in the after picture at 12 weeks, her hair had stopped shedding. It became much more manageable, much smoother, much softer. So she was actually thrilled, and she's in fact the woman in the video who says that it works. And she is telling you firsthand of her experience. Next slide, please. This is a 49-year-old woman with female pattern hair loss. She and her daughter were both in the clinical trial, both with these very nice results. Next, please. We have a 58-year-old woman here with early female pattern hair loss, and she was thrilled to see her part filling in. Next, please. This is a 35-year-old Asian woman, again with early female pattern hair loss, and again very happy at the 16-week point to see how her hair was filling in. In fact, she was somebody who went out of her way to tell me that people were coming up to her at work, at the gym, you know, all over the place to compliment how nice her hair was looking, how shiny and how well it was filling in. Next, please. Here's a 79-year-old woman who, again, had just a beautiful result with her part filling in and her hair becoming thicker and fuller and much more manageable. Next, please. So, as you can see, as you've seen from the pictures, regardless of age or race or cause of the hair loss, as long as the follicles are not scarred across the board, we're seeing women with these beautiful results. Next, please. The ReTress is now available in select Sephora stores nationwide and on Sephora.com and on ReTress.com. We've consistently been well reviewed. We have an average rating across the board of 4.2 out of 5. We're also now being offered in many dermatologists' offices, plastic surgeons' offices, OBGYN's offices, and in high-end salons. And it's such an education-driven product line that it's really great to have the opportunity for the women to speak to their stylist or to speak to their physician or physician assistant when they're talking about their hair loss. And once they understand the product line, and then it's going to take some time. This doesn't happen overnight, but the results are worth the wait. Next, please. We've been noticed. We've been, as you can see here, featured in several magazines. We've won several awards. But the most rewarding part is that now we're starting to hear back from our users via our social media platforms. We're hearing them tell us how well they're doing and how much they are enjoying their experience using ReTress. Next slide, please. And you can see some of the pictures here that people have shared with us. Either young women from Sephora.com or different stylists have been sending us their before and after pictures. The woman in the upper right corner with the long red hair came in just devastated when she started. She ended up, the stylist ended up sending her to me, and she was very teary and emotional, the first time that we met. 6 months later, you can see how her hair transformed. She still had some kind of spindly ends, but at 9 months, you can see that her hair is beautiful. The full length of her hair is pulled out. It's much healthier than it was when she started. I have never met the patient in the bottom right-hand corner. This is a woman who was 6 months post-chemotherapy in this before picture where she just has a few little patches of hair growth. And she reached out to one of her friends who just completed chemotherapy. And her friend, she knew, was using ReTress. And her friend said, let me send you a kit. So her friend bought her a kit and sent it to her. And in the after picture on the right, what you are looking at is 6 weeks after using ReTress. And she sent her friend back an email, and the subject line was, look, I have hair. And that is just, that's joyous for me. That's just really so gratifying to have somebody that I don't know, of course, to have this kind of an experience. Next, please. So, as much as I would love to tell you that ReTress is the only thing on the market, of course it is not, and it's important that we combine every opportunity that we have for these women in order to give them the best possible results. So as adjunctive treatments, there are definitely medical treatments, which we've touched on. I'd like to talk a little bit today about PRP, which is platelet-rich plasma. I'll also talk a little bit about low-level light therapy. Of course, there are some wonderful wigs and hair pieces now. In fact, I have been fooled recently by a couple of patients, which I always pride myself on the fact that I'm never fooled. So we've really come a long way for patients where it's too late to get them to regrow their own hair. The hair prostheses have come a wonderfully long way. And of course, there are hair transplant options. Next, please. So what is PRP? Next, please. PRP is platelet-rich plasma, and it's really gained a lot of notoriety recently because it's kind of revolutionized, again, the hair loss market. So it's very easy to do. What we do is we draw the patient's blood. We centrifuge the blood for 10 minutes. When we do so, the packed red cells go to the bottom. Next slide, please. This is a picture of exactly what I'm talking about. You can see the packed red blood cells at the bottom. There's a separator gel, and just above the gel is a concentrated amount of platelets. And so when we draw off the top of the serum, the plasma that's at the top, and we're left with this very concentrated plasma that's richly infused now with platelets and platelet-derived growth factors, we inject that into the scalp, and we've been seeing some very nice results. Now, this is not something that's only being used in the scalp. In fact, it's relatively new to the scalp, but it's being used in a lot of different areas in medicine. Dermatology, plastic surgery, aesthetics. Like people may have seen Kim Kardashian do the vampire facelift a few years ago. Even for sexual wellness, it's being utilized. You all might remember before the 2016 NBA championship that Steph Curry had a torn, I believe it was MCL ligament. In addition to surgery, they used PRP, platelet-rich plasma, to help to stimulate wound healing so that he could play in the tournament. And, of course, we remember how beautifully he played. So next slide, please. So to give you a little bit more information about how this works, normally, let's just take a normal injury. Let's get away from the hair for a second. Normally, say you fall down, you cut your leg, and you're bleeding. Well, the way that your body stops the bleeding is that it sends in platelets. Platelets come in and stop the bleeding, and then platelets release growth factors, platelet-derived growth factor, CGF and epidermal growth factor. And then white blood cells also send in VEGF, which is the vascular endothelial growth factor. And all of these growth factors work together to stimulate the healing cascade. Next slide, please. So with PRP, what we're doing is we're taking that idea and speeding it up by dramatically increasing the concentration of platelets and therefore the concentration of growth factors at the site of injury. So normally, where the inflammation period would last for 10 days without PRP, with PRP, we're seeing it lasting for 1 to 2 days. Normally, where we'd see that cell recruitment and that healing cascade getting started over the course of 30 days, with PRP, we're seeing it happen maybe in 10 days. And that tissue remodeling phase can take over a year, but with PRP, we're seeing it happening much more quickly, maybe in 100 days, 3 months or so. Next slide, please. So to give you a little bit more of an explanation about what's happening with these platelets, the platelets, when they're activated, meaning when there's an injury, the platelets become dendritic. That means that they have tentacles going out in every different direction, which you can see here in the activated state. And when those tentacles come out, they impart the growth factors to the surrounding skin to stimulate this healing cascade. Next slide, please. So by taking these growth factors, the PDGF, the TGF, EGF, and VEGF, as you're seeing here, that should be VEGF, we're stimulating blood flow, we're calming inflammation, we're promoting healing, much like what we talked about with ReTress. In fact, they do work very nicely in conjunction together. Next slide, please. And so by using this combination, we're seeing very nice results. This is a 49-year-old male patient. Now, it doesn't happen overnight. Picture A is the before picture. Picture D is the after picture. It takes about 2 years to see this kind of a result, but this is a fantastic result. This approaches what you would see with a hair transplant, but with no downtime and with a lot less pain and a lot less expense for the patient. Next, please. So again, to drive home why this is so much better than just drawing somebody's blood and injecting it into the scalp, it's really the concentrated platelets that are lower down in the plasma that we're going after. So we draw off if we're using a 22 ml syringe, we'll draw off. By the way, this is the Lllt system that I absolutely love. It's been so easy to incorporate into our practice. And with the Lllt system, we draw off the first 6 cc's and discard those. What we're left with is 6 cc's of very rich plasma that's richly infused with growth factors. I like to think of it like Miracle-Gro for the hair because you are really giving such nutrients and such support to those follicles. Next slide, please. So here's some more before and after pictures. This is a 19-year-old female with pretty severe female pattern hair loss. This is after 3 treatments. It did take about a year and a half to get this kind of a result, but it is a nice result. Next slide, please. And here's a 45-year-old woman. This was a total of 7 treatments. The interesting thing is the only area that was injected is the area that most severely impacted in the front. I believe this is traction alopecia, but what you can see is that not only did that area fill in, all of her hair, all over her scalp filled in. So she really had a fantastic result. Next, please. Again, here's a woman with traction alopecia. This is 4 treatments. Next slide. This is a 51-year-old female. Again, 7 treatments were required, but she has almost complete restoration of her hair follicles. She looks like she's had a transplant or like she never had a problem to begin with. Next slide, please. Here's a 68-year-old woman. Again, this is after 6 treatments. And by the way, in terms of the protocol, we typically will do one treatment per month for the first 4 months, and then bring the patients back maybe once every 3 or 4 months for a touch-up. Next, please. So next is low-level light therapy, LLT. Next slide, please. So with low-level light therapy, these are devices that are now FDA cleared. They emit red light, which is in the 630 to 670 nanometer range. It's unsure exactly how this works, but it's believed that low-level light therapy increases blood flow to the scalp to stimulate metabolism in catagen and telogen hairs. So it stimulates metabolism in those hairs that are either resting or shedding, and so ultimately that results in the production of growing hairs, anagen hairs. Next slide, please. So these are some examples of some of the different forms of LLT that are available. There's the helmet that you could have in your office or your salon. There's the iGrow helmet that they can wear at home. The laser cap is nice because you can put it on, and as you can see from this woman on the upper left, she just looks like she has a baseball cap on. You'd never know that she's actually being treated for her hair loss as she's walking around. Also, the Hair Max laser is very popular, and then this headband is the newest one. So we have lots of different options. Next slide, please. And here are before and after. So before and after with low-level light therapy, again, it's a nice result considering that it's non-invasive and relatively inexpensive and something that, depending on which one you choose, she could even do at home. Next slide, please. So I want to just drive home that there are lots of different things that we can do related to women's hair loss. It is important that we don't dismiss it. I can't tell you, of all of the patients that I have, and I treat every different problem in the skin, from anything, skin, hair, or nails, the one thing where I consistently have people come in and they sit in my office and they cry because of the emotional devastation, and it's women with hair loss. So please don't discount those patients. I know that I'm speaking to the converted with this presentation, and I just want to thank all of you for your attention and for your dedication to this cause.
Dr. Spann, I just want to thank you so much for imparting all your information, your expertise, and for your formulation and your development of ReTress with us. I do have a couple of questions from the viewership. In the interest of time, I'm just going to read two. The first one almost sounds like a comment, but I think we have a question. It said, it looks like you are receiving amazing results 16 weeks into treatment. And the question is, once the client gets to a desirable state of restoration of hair, what is the maintenance to retain that hair? Is it unlike minoxidil that you have to, if you stop using the product, you receive hair fallout again? And how does that maintenance work for treatment?
Thank you so much. That's an excellent question. Because hair grows in a cycle, there is not any magical thing that I can tell you that will be effective now that will remain effective 6, 7, 8 cycles from now. So just like with minoxidil, with anything that you're doing where we're treating hair loss, it is important to continue to use it in order to maintain the results. What we've found by and large is that people really enjoy continuing to use it because it does make their hair more manageable, and it does smell great, and it does make their hair look better and thicker and fuller. So as opposed to people dreading that they have to continue to use it, they actually look forward to it and enjoy continuing to use it because they're so pleased with the results that they've experienced.
Okay, that's great information. Another question, it says, as a trichologist who offers follow-up care to PRP and the laser-assisted hair transplant, what would be the ideal use for a client coming in conjunction with the low-level light therapy and those type of services with the ReTrust system?
Oh, thank you. That's an excellent question also. Yes, this is absolutely something that can be used. It basically will just take the place of the normal shampoo and conditioner in patients who are using low-level light therapy or post-hair transplant. In fact, we do have quite a few hair transplant surgeons now who have incorporated ReTress into their regime for their patients because they find that with them using the shampoo and conditioner in place of whatever they were using before and using the serum daily, that in fact it's actually improving the results that they were seeing with their low-level light therapy, or it's sustaining the results, helping them to keep more of the transplanted follicles in patients who have had hair transplants.
That is awesome. And this is a personal question, and I'd like to let the group know that I'm so honored for Dr. Spann to be able to give her time to us today, to the Hair Loss Professionals group. I've read a lot of information about Dr. Spann. I'm very impressed, and I actually got to see her product, ReTress, in a Sephora some time ago. And so when I reached out to her about the possibility of being a presenter for our group, and she so willingly said yes, it just speaks to the volume of the type of impact she intends and wants to make for women dealing with hair loss, because women with hair loss are definitely treatable different than men. But I want to know personally, and this is going to help sure some of the other group members to know, because I know now it is being offered to select salons. How would someone, say a salon owner such as myself and possibly some of the other group members that would possibly want to be a distributor, have that to offer into their salon or hair treatment center, how would they go about getting your product to do that?
Oh, thank you so much, Stephanie. Thank you for the question. Thank you for the opportunity. Thank you for your dedication. Thank you for your commitment and your support. And we would absolutely love for you or other salon owners to come on board, especially within your group. We understand that you are dedicated to the same mission that we are. In terms of distribution, my assistant Danielle is one of the best people in the world that you have ever met, and she can help you get set up, and she will walk you through everything. The best way to reach her is at her email. That's Danielle, DANIELLE, at retress.com. That's ReTress.com.
Now, you heard it here, and in addition to, you could tell how lovely Dr. Spann is and how helpful she's been. I've had the opportunity to work with Danielle, and she's very easy to talk to, and she would get back with you if you had any questions or concerns about acquiring the product. So in the interest of time, I guess this is going to end today's webinar, but I want to say, remember, for those of you who weren't able to ask questions, you can still send any questions about anything that you have regarding the webinar today to customer care at trinitylacedwigs.com, and I will make sure that I will forward those questions to Dr. Spann, and she will answer any questions, and we will post them to the group. So, again, I just want to say thank you, Dr. Spann, for taking out the time of your busy schedule to speak with us today. We really appreciate it.
Thank you so much. It was my pleasure. Thank you, Stephanie.
Thank you. And that's it for today's webinar, Hair Loss Professionals Group. Until next time, more hair.
More hair.